Dr. James Choo is a Knoxville native. He graduated from Emory University with a Bachelor of Science degree in anthropology, then went on to the University of Tennessee Health Science Center in Memphis, where he earned his Doctor of Medicine degree. He then went on for a residency in anesthesiology at the Ochsner Clinic Foundation in New Orleans, and then on to the University of New Mexico for a pain fellowship. He is board certified in both anesthesiology and in pain medicine. Back to Knoxville, he founded Pain Consultants of East Tennessee, and he serves as the medical director of the Pain Consultants of East Tennessee Surgery Center. He has been called in by, among others, Governor Bill Haslam to create chronic pain guidelines. He served on a panel back in 2014 and has spoken before the Tennessee legislature on policy concerning drug abuse. So we are very fortunate to welcome today Dr. James Choo, talking about trauma, pain, and the brain.
Well, thank you very much, Amanda and Dr. Littman. Can everybody hear me? Hopefully. Okay, great. So this is my first Zoom conference talk, and I'll try to do my best to muddle through it. But this is my second time talking to the UT Science Forum, and I really appreciate the opportunity to be a part of this. And so really, I kind of left off my last talk to talk, it kind of ended on trauma. I wanted to expound a little bit on it. You can reference the one that I did a few years ago to get some other details. I'm going to talk a little bit more about some of the things I've learned in association with the brain as and some of the factors for resiliency and other social programs and other things that may be helpful in the backdrop of pain and the science behind trauma and all that may go along with the particular problems of intergenerational trauma in respect to our society today. So I will give a little bit of a kind of an overview of what I do. I'm a pain physician here in Knoxville, and what we realize that pain is really a disease of the brain itself. It's a $600 billion problem in annual expenses and lost wages. That number might be higher than 600 billion, might be upwards to 700 plus billion at this point in time. That was an old study back in 2011 with the Institute of Medicine that determined that the state of pain costs more than cancer, heart disease, and diabetes combined when it comes to medical expenses and lost wages. There are very few pain physicians that are out there that are trained in my field, and so there have been a lot of initiatives to increase pain awareness and pain training amongst primary care providers, other providers that are out there. But we're far from really getting a handle or grasp on this particular disease itself. It's been so difficult this year to do our job as it has been for everybody else. This is the first time I've really kind of got to engage in the idea of trauma and go back to this thoughts on how we best deal with pain and trauma since the beginning of this year, and everybody else has been had to deal with the monkey wrench of pandemics and everything else. So I'm glad to be doing it again. I'm glad to be talking about something that's so important. But really, this talk is kind of a little bit of a description of my own personal journey and understanding some of the deeper problems that are going on as it pertains to health and society. It started out with pain, and it's really started out with my understanding of what led to an opioid crisis, and in particular, a prescription drug crisis. There were well-intended consequences that were well-intended efforts that led to some kind of deleterious consequences. And really, early 20 years ago or so, there was this idea that we could take care of pain aggressively with pain medicines, pain drugs, opioids in particular, and that we could aggressively treat pain like you would with blood pressure. So if someone had a pain score up to 10, a self-reported pain score of 10, you could give medicines, in particular opioids, at high doses. And really, that was a leading thought at the time of treating pain aggressively with as much opioids as possible in order to drive the pain down and the pain score down. And really, that led to some unintended consequences throughout society. And those leading thoughts became leading folly and led us down a road of an opioid crisis. And in particular, there were some entrepreneurial efforts to capitalize on this idea that you could chase a pain score and really and give as much meds as possible in order to drive pain down. And there were some bad players, bad actors that are out there in South Florida, Ohio. And really, when some of these clinics were shut down and down in those areas, they came really up and migrated into this area, into Appalachia, into northern Georgia, East Tennessee, and all throughout parts of the West Virginia corridor. And why in particular those areas were really hard hit, it leads to a long culture of substances and substance abuse in particular areas that were impoverished and have been for a long time. And East Tennessee has been one of those areas. And so when I left medical school and left fellowship, I never really realized that when I came back to this particular area, I'd be dealing with such a hard issue where we saw that pain medicine was really at the forefront of a lot of finger pointing, that we were considered the big problems in our area, because when you looked at those who were arrested, those who were having issues with the law, a lot of it circulated in this area around prescription drugs. And this was very true 10 years ago, right around the time I came back to our hometown, to my hometown. And so there were a lot of efforts to really try to crack down on pain clinics here in this area. And we ran what we thought was a legitimate pain clinic, and what we continue to feel that we're a legitimate pain clinic. So we tried to partner up with a lot of individuals around the community and state, including law enforcement, including our political friends in Nashville, in order to say, hey, how do we stop this? How do we legitimize the field of pain? How do we crack down on the bad actors? And when we did so, especially we saw a lot of other unintended consequences. We'll talk about that here in a second. But really grabbed legislators' attention was neonatal abstinence syndrome, especially in this area. We were some of the leaders per capita in prescription drug abuse here in East Tennessee. Neonatal abstinence syndrome was something that really grabbed the attention of policymakers when they saw and heard about the staggering amounts of children that were born under the influence of opioids, especially in East Tennessee Children's Hospital and UT system. Really grabbed the attention of policymakers, and really people started working really hard on how best to legislate this issue, and also how to talk to a bunch of stakeholders on this really multifaceted issue of drug abuse. And so when we were successful in cracking down on a lot of pill mills in this area, but the thought was, in my thought, was that once you started cracking down on pill mills, that the prescribed drugs would decrease, and then we would potentially have heroin that would come into this area, but that we would potentially save a lot of lives because we had gotten rid of the quote unquote doses of drugs that were really causing so much of the maladies in our area, especially when it came to crime. But that was really not what happened. Paradoxically, as we started cracking down on the prescribed drugs, the black market of heroin and fentanyl and fentanyl derivatives really started increasing in this area via way of Detroit, down our highway systems. And many of these drugs were created in in Asia, brought in through Mexico and through drug activities, cartel activities that directly influence our communities. And these drugs are far more potent. They're less controlled. And so what we saw paradoxically in this area is that more people were dying, and we weren't saving lives in particular. And so the other issue that I really found out to be kind of shocking to me is that there were a lot of also well-intentioned efforts to help with some of these drug-addicted individuals' usage of medicines like Suboxone, which is a drug that is used for helping individuals decrease their cravings, decrease and help them detox off of opioids. And this drug in particular was heralded as a drug that could save a lot of lives, and it probably does to some extent. But what we began to realize is that this drug also had a lot of abuse potential and had its own street value and its own value within the jail systems itself. And so you can see here, this is a stamp that is sent to someone in prison, and beneath the stamp is some Suboxone as well, and it has its own value within the jail systems. And so it didn't seem to me that that the drugs themselves were really the problem in and of itself. And let me explain what I mean by that. When I looked at the data of those who were dying from opioids, it didn't look to me as if it was one particular drug that was killing individuals. It was a combination of drugs. And so really it was opioids, multiple different opioids in conjunction with benzodiazepines or other types of sedatives, alcohol, even other types of non-addictive prescribed drugs. It was really polypharmacy that was killing a lot of these people, the drugs and combinations that kill individuals. And it didn't seem to me that some of these individuals who were being saved by what we call naloxone, naltrexone, individuals that were patients that we found in the emergency room that were found down because of opioids would be given naloxone or naltrexone as a means to reverse the respiratory suppression of opioids. And these individuals would wake up on the brink of death and be released from the emergency room and go immediately and score their next hit of heroin or carfentanil or whatever it may be. So death, incarceration really didn't seem to scare any of these individuals. The drive for addiction was really the driver of behaviors in particular. And again, people who have problems with substances will find any way, any means possible, get their hands on something to make them feel differently. And so it didn't matter if you could substitute opioids for alcohol. You could substitute alcohol or these opioids for methamphetamines. We're seeing a huge spike in methamphetamines. And so the prescribed drugs have been replaced by multiple other illicit drugs that are more dangerous in a lot of ways. And that are being muled in across the borders into points like Detroit and being trafficked right into our area. So these individuals were very, very motivated. And it wasn't as soon as you stamped out one substance, another one would quickly replace it, and sometimes with more deadly consequences. And so what we have seen in the past 10 years or so is that in America, our life expectancy has dropped for the first time in over 30 years or so. And so really, when you talk to some of the thought leaders in Princeton, some of the economists that were looking at this information, non-Hispanic white population especially were the most likely to were the most likely reasons, or the population that was responsible for the drop in mortality or the drop in life expectancy here in the United States. And a lot of this might have been attributed to the loss of jobs. in particular areas as industries were left to that were here in the United States and then carted away to other countries. Non-Hispanic whites were losing their jobs in Ohio and a bunch of different other regions. And so the deaths of despair, as Case and Deaton had really kind of illustrated, were really hit home, not only by a result of a multitude of factors: drugs, alcohol, and suicide. And so alcohol-related deaths are an all-time high. We're seeing that right now in Knoxville. In particular, there's been a large spike as a result of increased alcohol utilization. There's been a large uptick here in this area, upwards to 40% increase in alcohol sales during the pandemic, and the University of Tennessee is seeing an unprecedented number of individuals that are dying on the floors as a result of alcohol-related deaths. Suicide was another reason for the drop in mortality, and Deaton said it best: the underlying deep malaise would be there even without the opioids. So there was something under the waters that made me really kind of delve into this world of why our area in particular was most at risk for so many of these problems: suicide, alcohol-related deaths, and opioids. What were those underlying problems? And poverty is probably a long story in the history of East Tennessee and Appalachia. If we look at the history of Appalachia, they were poor people that left the Scott-Irish area, came down into Pennsylvania, that couldn't afford the land over there, and settled into the southern parts of Appalachia and northern Georgia, East Tennessee, so on and so forth. The land was very similar to the lands that they left, and so they had brought with them whiskey and means of making whiskey, and also their culture in particular. But this is an old picture from the Time Life article, and that showed a family up in West Virginia. And there were a lot of social interventions around that time to help bolster the economy of Appalachia. This is, of course, Dolly Parton's coat of many colors. And you see in the background, there's children that are pointing to Dolly Parton's old coat and laughing. So Dolly ended up, of course, being in the Sevierville area, was poor herself. Her mother, a mother's love, wanted to make her daughter a very special coat, patched together a bunch of rags and made this coat for her. She turned it into one of her most famous songs, and it was really a song that talked about poverty and a mother's love during that time. Despite she was really proud of her jacket, but these children were making fun of her. And of course, this is a blouse of many colors, an homage to her own song. But I can guarantee you that those the materials are not rags anymore. But this blouse is not designed by her mother, but probably by Armani. But Dolly has been a champion for this area, East Tennessee in particular, and has brought a lot of jobs and lifted Sevierville out of helped lift Sevierville out of the throes of poverty herself. And really, the key portion to that song was the mother's love, and we'll talk about that and as a resiliency factor in the face of stress and poverty. And that's an important part of how people can rise up under tough circumstances. And so, again, we talk about whiskey technology. This is Popcorn Sutton, and behind him is his whiskey distillery. When you're poor, you don't have a lot of means to take care of yourself. You don't have a lot of things don't grow in this particular area that can be worth a lot of money. But you get a lot of corn, get a little mash, get a little distillery, you can make some money and buy some of the nicer things in life. And moonshine was a way of doing that. It's even in our fight song here in Tennessee. We get our corn from a jar, and there's a reason why it's such a popular song in this area. It's part of the culture. And if anyone wants to read a memoir, that it really illustrates the modern day kind of biopic on Appalachia. J.D. Vance, who is now an attorney, he was from the Kentucky, Ohio area. This story is about his mother, Appalachia. It's also about a story of his mama, his one committed adult who really helped him along and was supportive under so much chaos in his life. I read this story in this book, and I think about my own wife, who's from Kentucky, and her family. I also think about my patients in the Cumberland Gap area, that is that I-75 corridor that goes straight up to Kentucky. I think about a lot of my patients that have lived a very similar life, and a lot of staff members and a lot of people can really attest to the stories of the hardships of poverty in this area, and the social dynamics and the family dynamics. J.D. Vance does an amazing job. And again, a man who had an unlikely rise out of poverty to Yale, to law school. He had that one committed, loving mama, one committed adult that helped him be resilient under such harsh times and harsh circumstances. And really, another eye-opening situation for me, I guess, kind of revelation, was the intergenerational trauma. The stories I was hearing from OBGYN doctors who were really trying to grasp, take a handle on some of the neonatal absence syndrome. And what they would relay to me was that when they talked to the mothers who knew that they had a problem, didn't want to be on these drugs, knew that they were having a child that was exposed to all of these drugs and didn't want that type of life for their children, but were compulsive in their drives towards taking drugs. Intergenerational trauma was the theme that was told over and over again through the ears of the social workers and psychologists. So that really, despite the drugs that are out there, this one particular substance that you can think of, again, I strongly believe that motivated individuals who aren't scared of incarceration or death, and are even under pregnancy, understand the risks to themselves and their unborn child. The compulsion of drugs, the substances will always be there. The polysubstance abuse is the name of the game. But what was going on, this intergenerational trauma, what is it doing to our community? That was what led me down to really trying to understand more. Teen suicides were on the rise in Tennessee as well. And so really it led me down the road of adverse childhood experiences. Adverse childhood experiences was first looked at by a weight loss or internal medicine physician in California named Vincent Folletti. Vincent Folletti had a very successful career as a weight loss physician. And when he interviewed one of his patients who had lost 100 pounds and was doing great, and then when she came back a few months later, she had gained all of her weight back and more. And he asked her, he said, look, you were doing so well. Why is it that you have gained all of your weight back? What happened? And she said, well, when I lost this weight, I was getting all of this attention from people of the opposite sex for the first time. And she was compelled to eat again. You can go back to eat. And he said, well, why would you want to eat again? She said, well, to be overweight is to be overlooked. So that gave him pause. Dr. Folletti's pause to think, well, there's something deeper that's going on. And of course, when it's not so simple when it comes to weight loss, that it's not just a matter of food choices and food. There are underlying behaviors that might be driving the food choices or just the drive to eat. And of course, when he interviewed her, she had a long history of sexual abuse. And so he got together with Robert Onda from the CDC and Kaiser Permanente, and they started looking at adverse childhood experiences. And here it's divided in 3 different sections: abuse, neglect, dysfunction at home, and abuse in the physical, emotional, sexual form, neglect and physical, emotional, dysfunction at home, and mental illness, incarcerated relatives, mother treated violently, substance abuse, and divorce. And it's yes or no questions. And the findings were absolutely unbelievable. And it was a dose-dependent effect. So the more of these experiences that you said yes to, they realized that the health outcomes were really affected deeply. And so if you have experienced trauma, you're more likely to develop problems with alcohol, inject drugs, engage in risky sexual behaviors, more likely to smoke, have serious problems, experience depression, fail at your work, and commit suicide. And so what is going on with trauma has long-lasting impact on the well-being and health of an individual's life. And so you're also more likely to have unintended pregnancies, HIV, traumatic brain injuries, fractures. A lot of health outcomes are are more likely to be impacted the more traumas that you have in your life. And Harvard looked at population attributable risks. I thought one of the most important developments, or actually insights to some of the ACE work, was that cardiovascular disease, cancer, would have never guessed that those factors would have been increased as a result of the more traumas that you have. If you were to remove those individuals with 7+ ACE, answered yes to 7 or more of the ACE questions, and they happened to be non-smokers, they're 360 times more likely to die of an early death, in particular ischemic heart disease. And so it's not just the behaviors. Maybe it's one would think that these higher ACEs will lead to smoking or something like that. There's something within the body itself that is fundamentally changed and in a way that it negatively impacts your health. And so if you look at how much ACEs cost to Tennessee, this study by the Sycamore Institute in 2017 looked at the impact of ACEs as $5.2 billion annually in Tennessee. That does not include opioid patients or opioid Tennesseans, which you could add another $1 to $2 billion on top of the annual impact. So it is very, very costly. There's a nice conceptual model of what ACEs do, and it impacts your neural development, social, emotional, and cognitive impairment, and it leads down to risky behavior and ultimately early death. And we can look even a little bit more closely at this here in just a little bit as to why all of that may occur. But I think Robert Ondas, when he was taking a look at all of this data before him, and he was just flabbergasted at the impact of child abuse. And he really came to the conclusion that child abuse may be our most important health-related silent epidemic that is going on right now. It costs more than cancer and heart disease combined. And if you were to remove child abuse from our world or in our country, we could decrease depression in half, alcoholisms by 2/3, and suicide, IV drug abuse, and domestic violence by 3/4. Incidentally, we'll talk about this here in just a little bit. Domestic violence, drug abuse, suicides, homicides are really at an alarmingly high rate right now during the pandemic, and we'll talk a little bit about why that might be. And so it doesn't take, I know we have a bunch of science fans and scientists here today, and maybe some of you are neuroscientists and maybe some of you are not. But it doesn't take a lot to visualize what this toxic stress, what trauma can do to the brain. You look at the image on the left, a robust, healthy brain, and one that does not look as robust and healthy on the right. And so what are the underlying mechanisms behind trauma? And why is it so impactful on the brain? But so really when we talk about trauma, we have to think about the hypopituitary axis. And this is the part of the brain that is involved in our flight, flight, or freeze experience when we're going under stress. And this is a highly adaptive system. And so if you were held up at gunpoint, if you were being chased by a bear or in some type of extreme danger, having this type of HPA axis, this fight or flight system, allows you to fight off the bear, fight off the intruder, run away from danger, gives you extra energy to escape. Part of that is because of the cortisol that's in your system, which is a glucocorticoid that, when increased, gives you a little extra energy. Your sympathetic nervous system is engaged. It gives you more strength to run away or to fight. Gives you extra heart rate, gives you a little bit more of a burst of energy to escape the problems. But the question is what if this HPA axis is always on? And so that may very well occur in those who have experienced trauma in the form of PTSD, post-traumatic stress disorder. Or what if this is your loved one, your mother, your father, a close loved one that has sexually abused you or mentally or physically abused you, or that you're seeing and experiencing it all the time in your life, around it during certain early times of your life. Well, this HPA axis never has time to shut off. So there are researchers that have called this the allostatic load. So the stress hormone response during childhood could potentially be measured. I don't think we've successfully done that yet, to see how much of this has been ramped up in a young child or in a person in particular. And so the higher that load, the more stress you've experienced in your life, and maybe that can predict whether or not your health outcomes will be good or bad. But what this does is, as cortisol increases, you have a incredible amount of stress on the system. You are never able to escape that danger. That's danger that is always present to you. You're maybe in the form of a loved one is always there. So as you are being ramped up with stress, you can undergo adrenal fatigue that can have extreme consequences on your immune system, on your brain health, in particular the prefrontal cortex of your brain. And this, we'll talk a little bit more about why that's so important. So you never are feeling safe in your own body, your own environment, and your own circumstances, and your health outcomes, your brain, your body is always in this state of panic and fear, and it destroys your health over time. And so especially in the critical portions of life, especially in those years before the age of 4, and also in the period of adolescence when your brain is really growing and expanding, those are the most important times. And I would say really before the age of 4. These critically sensitive areas of development, when you experience those childhood experiences, it really impacts the architecture of your brain, and it hardwires negative adaptations. So that leads you to psychiatric disorders, inabilities to thrive in work and school, obesity, alcohol, risky sex, on and on and on, intergenerational problems, poverty, and crime. Okay. And so also your genetics and epigenetics have a role in all of this as well. And so when we think about as a clinician, as a doctor, I look at my patients' records, and I look at oftentimes how we'll see some of these patients that are really struggling with pain, really struggling with life. They have a long list of medication, might be on 14 to 20 drugs for different health maladies. Oftentimes, those are just symptomatic of an underlying traumatic childhood or traumatic complex traumas in their life. And so really, if we were to look at the diagnoses of certain diseases, in particular mental health diseases, there's what we call the DSM-4 criteria that look at all of the diagnoses of psychiatric disorders. Really, on its inception, it was not supposed to be a list of diagnoses, but a list of symptoms. And then it slowly evolved into a list of diagnoses. And there's some movements out there when you take the lens of trauma, especially in the developmental portions of life, from birth to young adulthood, when the brain is really growing at that time and you're experiencing complex traumas punctuated at certain points of your life that manifests itself into mental illness and disease. Okay, so if you were to experience attachment disorders, we'll talk a little bit more about that, emotional disorders early on in life that manifests itself into bipolar, disassociation and personality disorders. Those are all maybe symptomatic manifestations of complex traumas in life rather than particular diagnoses. And we see that in medicine when someone has a long set of mental health problems and issues, substance abuses, ADHD, self-injurious behaviors, personality disorders. That's really not individual diagnoses, but someone that has experienced deep-seated trauma in their life. And so really having that mental schema of trauma and the brain development is something that's lacking in medicine and something that probably needs to change. And so if we look at the individual himself who has experienced abuse early on in life, what does that person experience? What are their feelings during that time? And then really it's this lack of safety in one's body that trauma can lead to really all sorts of maladaptive experiences, maladaptive behaviors afterwards, because really in the end, if you never feel safe within your body, if your body is always in this state of fear, lack of safety, really oftentimes when you think of substances and polysubstances, people taking things to make themselves feel differently from their current circumstances, you can understand why a lot of people are driven to smoke, to drink, to take pills, to do whatever it takes to feel differently from when they feel so uncomfortable and so unsafe within their body, if that makes any sense. And so as a pain physician, it took me a long time to understand this. And really, it wasn't through my pain training. It was through my inquiries into trauma to understand why is it that we had so many patients, even with pain, that were having symptoms of pain, discomfort in their own bodies that never really manifested itself and showed up on clinical examinations or x-rays or MRIs. We knew that they were really suffering from something that made their bodies feel uncomfortable. And if you delve deeper into their past, oftentimes, the majority of times when you have some of those unexplained problems, whether it's fibromyalgia, which is a type of pain symptomatology when your body hurts all the time, there's a high association of previous traumas in some of those patients, and even certain diseases like rheumatoid arthritis and other inflammatory diseases that when the immune system attacks the body, there's a higher preponderance of trauma in a lot of those individuals than those who don't have those experiences. So the immune system, the brain is in the body are affected so deeply by trauma. And when people overeat, overdrink, and engage in impulsive behaviors, sexual behaviors that are maybe dangerous, oftentimes it's an escape from the current circumstance. And so really a lot of the work in trauma, pharmaceuticals aren't all that great. Really, it takes a much different type of therapy that most physicians aren't well versed in. And we could talk about it later at some other point in time, but yoga, there are other modalities that have been shown to be very, very helpful. Even theatrical therapy that have been used for trauma that can be quite helpful. And some also neuro training as well, using computers to kind of help modulate some of the brainwave activities that are abnormal in those individuals who are experiencing trauma. It takes a lot of different types of care that the Western allopathic system is really not very well versed in. Pharmaceuticals fall short oftentimes. And so if we're to think about the second law of thermodynamics, and we're thinking about it's really kind of an important law that governs the universe, essentially, from order to disorder. Really, what is trauma? But the chaos of the social world, social entropy. And it's really easy to fall into a trap of thinking that a lot of this trauma, intergenerational trauma, and some of the most difficult portions of crime, the most troubling portions of our societies today, that we can be fatalistic and say, look, you can't really help these individuals. And this is a problem that has been going on for time immemorial, that especially in Appalachia, or you name some impoverished, at-risk area, that these people are the way that they are. There's no way that we can get our hands around this. And that fatalism is really kind of the enemy. And then we also have to think about what we see and consume in the media. Because really the media is ill-equipped to discuss or divulge or really kind of expound upon some of the most important topics when it comes to some certain issues with society and health. There are a lot of sound bites. Some of these issues are so complex. This requires some scientific background, and it's sometimes not as well expressed in shorts, media sound bites, so to speak. And so narratives are also really a big part of the media. And so oftentimes we have to shed our biases, so to speak, and really take a look at some of the facts that are out there in this world, especially when it comes to what has happened in the past. And we have to really thank our enlightened forefathers during the time of the Enlightenment, and thank the Humes and the Spinozas and Locke's of the world, and the scientific revolutions of that time, because since that time the world has really improved quite a bit. If we were to step back and take a look, especially in the past 100 years, that poverty is at an all-time low throughout the world, especially extreme poverty. War has been decreased significantly, despite what we see on TV, in that there are less deaths in war. Not to say that all is great, but it's better than it was 100 years ago. That's for sure. Diseases have been decreased. Famine, violence is decreased across the world. Democracy has increased throughout the world. Market-based economies, life expectancies across the world, despite what I just told you here in the United States, which is the one outlier, has increased throughout the world. Education for men and women have increased. The life overall has improved. We have got a long ways to go. But sometimes that's not really well illustrated from what we are consuming on the day-to-day basis. And really, our minds and our brains may be well suited towards a blueprint of social construction, a social world. Maybe our minds and our brains have developed because of the to engage in a tribe, so to speak. And so cooperation, love, friendship, those are types of our brains have, especially prefrontal cortex, of flexibility of our minds are developed to engage in a social world. And when the social world has been disrupted early on in life as a result of trauma, our health outcomes, health disparities are negatively impacted. And so really what we have to do is to update our mental models and our mental schemas and how best to look at health, number one. And number two, what to do with some of this information on health, the brain, and our social determinants of health and our social world. Because the social determinants of health is what may be more important as a factor in predicting our own futures, so to speak. So a good example of the social determinants of health or of understanding it, especially in terms of zip code, if you were to take the zip code of Chevy Chase, Maryland, and to predict an individual who was born and raised in that particular zip code, your health outcomes or life expectancy may be in the 90s. 6 miles down the road, another part of Maryland, your health outcomes could be in the early 60s. So really, your environment as it pertains to health is maybe one of the most important, if not the most important factor in determining how well you will thrive in your life, as we've learned through previous studies. So really, to update our models, we've got to look at the brain architecture, in particular the early parts of development, especially in those critical portions in the first 4 years of life and also later on adolescence. And so if you were to look at basic science models by researchers in McGill University who looked at rat pups who are undergoing stress, and those mothers that licked their infant rats more often had infants that even despite the stress, the mothers that were attentive and licking their pups, those pups grew up to be more socially robust, more curious, lived longer, was more flexible when it came to engaging novel obstacles, were more persistent in finishing tasks, and thrived in despite the social hardships that were, or the hardships that were imposed by the researchers. And this also led to the attachment theories that were later on expounded upon by other researchers in human studies that looked at whether or not resilience, what were the resilience factors in those people later on in life. And really, if you were to think about the most critical portions of society, how we can really make the most impact, we need to start really thinking about social attachment, security, social close relationships between a mother or that one committed adult. Got to think about J.D. Vance and also Dolly Parton, despite their harsh circumstances, who were able to overcome so much because they had that one committed adult. And a lot of studies are showing that those who had secure attachments early on, especially before the age of 4, were better able to live a more robust, resilient life. There was a study that looked at those before the age of 4. Psychologists were able to predict based off of secure attachments whether or not a child would graduate from high school, and was more predictive than IQ. So those individuals that they found to have secure attachments in socially harsh circumstances were 77% more likely, or with 77% accuracy, able to predict that those individuals would graduate from high school. I'm not sure if I said that correctly, but bottom line, that first 4 years of life, a committed adult, mother's love is one of the most important factors in resiliency under any type of harsh circumstances, whether that's found in rat pup models or human models or human observations. And so really it's the serve and return relationship. So if a child is crying, an infant is crying, and you do not have an attentive adult soothing that child and talking with the child, or really undergoing that important bond of when an infant babbles, you have an adult on the other side of them engaging in talk. And also if that infant is engaging in stress, that you have an attentive individual or attentive role mother or committed adult soothing that child. That has an indelible mark in creating robust architecture for the brain, in particular the prefrontal cortex. Prefrontal cortex is that part of the brain, of the neocortex, or the newest part of the brain, evolutionarily speaking, that is developed and is plastic. And so IQ is really considered heritable and rather fixed. But the prefrontal cortex is something that is really formed and developed in the early portions of life, before the age of 4, and also throughout young adulthood to the age of 25, but in particular adolescence, where you're seeing a large expansion of neural growth during that time. And so the executive function portion is kind of like the air traffic control system at an airport. When there's a lot of chaos that is potentially going on and a lot of disasters that can happen, the executive function is to be able to flexibly deal with that particular chaos, and is in charge of thinking under stress, being resilient under stress, helping to modulate fear and use that, and is responsible for flexible critical thinking. And this portion of the brain is really well developed during those early portions of life, and is really developed all the way up to the point of about 25 years of age. And so really when it comes to how best we can serve our underserved, it's really thinking about this portion of the brain as we develop in life. Harvard has taken a look at it, and especially in that, like I said, you can see on the chart at the age of 4 or so, the brain's ability to change during experiences is really most critical at that early portion. In about the age of 25 or so, that starts to, your bang for the buck, so to speak, starts to diminish quite a lot. And so how does this translate into our lives? James Heckman was a Nobel laureate up at the University of Chicago that took a look at how best to spend money in order to get the most bang for the buck for our social interventions or interventions early on in life. So if you look here, that prenatal care, especially that attachment age, if you spend your dollars there earlier on in life, your return on investment is much greater than, say, after the age of 25. And so if you spend $1 per home visitation daycare preschool programs that work on attachment and work on a kind of healthier models of care, home visitation programs, you'll save $7 in welfare costs, substance abuse, incarceration, healthcare costs later on down the road in that person's life. That may also increase revenue as these individuals are able to obtain better jobs and are part of the tax-paying segment of the population. In the 1970s, a psychologist did a home visitation study where they intervened early on in life with home visitation programs 20 years later, those individuals that were a part of those programs were less likely to be in jail, were more likely to have a job, and more likely to do better in life. And so Harvard has taken upon looking at the brain architecture and development and uses 3-step program models that they're using in order to change a population for the better, to reduce toxic stress and have support those children early on in life, and teaching parents how to be more supportive parents, looking at detachment, and also giving them core skills early on in life. There are model programs that you can look at Harvard's Center for the Developing Child, and to look at what kind of programs that are out there on an evidence-based kind of criteria. And so even in Nashville, there's a trauma-informed program school in one of the more at-risk areas of school that are really trying very hard to adopt some of these concepts for their kids. And really, when it comes to health, we need to think about health and toxic stress. And I think this goes beyond narratives and really kind of if we're thinking about social programs and the dispossessed. If we think of things along the lines of poverty, trauma, we can really kind of get the crux of where some of our bigger problems are when it comes to health outcomes for our society and individuals. Center on the Developing Child is a great resource to take a look at it. And so this brings us to the coronavirus and what we're seeing today. And when we were talking about social distancing and the major disruption in our life, I could tell you right now, what was easily predicted in my mind when we were talking about some of these measures was that I knew that we would see an increase in homicides. I knew that we would see an increase in alcohol and opioid deaths. And in our particular community, that is exactly what's going on. And so we really have to look at some of these measures on a more holistic basis, because those are who are most at risk when it comes to certain some of these measures. Those who are most likely to lose their jobs, the ones that are most likely to fall short in life. When you start disrupting the social fabric, bad things will happen, and that is exactly what's going on today. One could think of coronavirus and some of the measures as a traumatic event, and it has been for many of us. But we need to talk more about those who are dispossessed, and look at the outcomes. And these measures oftentimes are not benign, and we're continuing to deal with them today. So I'm going to open up the floor to questions now.